So much for tuning into this episode of The Kim Jacobs Show. Be sure to subscribe to The Kim Jacobs Show right on YouTube. Turn on your notification bell to all so you never miss a beat. And guess what? Every time you watch, you're going to receive a real, relevant, and relatable guest that's going to share with you a piece of the puzzle on this journey called life that will help you be able to manage just a little bit smoother. At the end of the day, the Kim Jacobs Show goal is to be able to provide balance to the world, one household at a time.
Kim Jacobs Show. You're watching Kim Jacobs Show.
Hello, everyone, and welcome to this episode of The Kim Jacobs Show. I am so excited to have with us today Dr. Samira L. Brown. How are you today, Dr. Brown?
I'm doing fantastic. So excited to be speaking with you today.
I am so excited as well. Listen, everybody, grab your virtual seats as quickly as possible. Say your hellos. Hey, everybody, how you doing? And all of that as you're coming into the virtual studio audience. Grab your seat. There are a lot of seats available for you to come on in. You're our VIP guest. So there's no VIP section. It's just like all of us VIP, because each of you as our guests that are coming into the studio make this show what it is today. So we thank you for being in the virtual studio audience. And we want to hear your comments, your thoughts, any questions that you may have today. Make sure that you type them, and maybe Dr. Brown will be able to answer them. What we're going to do is right after this commercial break, we're going to do a formal introduction, and we're going to maximize this hour with lots of information that Dr. Brown is here to share with us today. Are y'all ready for this? If you're ready for this, type a 1 in the comments, and I'll make sure I acknowledge you when we come right back after this commercial break. We'll be back, Dr. Brown. Where are you located, by the way?
I'm in Atlanta.
Oh, okay. I'm in Charlotte, North Carolina.
Oh, so very close to each other.
Yes, I didn't even know that. That's the thing. I get a chance virtually to meet people from everywhere. I've had somebody come on from Hawaii, from the Philippines. I'm like, this is a great platform, you know?
Absolutely.
So I'm so excited to meet you. And Atlanta is its own different world, in my opinion. It could be a country. It's so different, in my opinion, than anywhere else in the world.
I absolutely love it here. Yeah.
Good. I love it too. Okay, let me take a quick commercial break, and we'll be right back in with a formal introduction of Dr. Samira Brown.
I'm attorney Kenneth D. Snow, and at the Snow Legal Group, justice is our job.
For more than 20 years, Attorney Snow has been fighting for justice and winning cases in the Carolinas by providing aggressive representation in criminal defense, domestic violence, family law, serious injury, and wrongful death. If you've been injured or lost a loved one in an accident, including tractor trailer or rideshare, you need the Snow Legal Group by your side, fighting for justice and fighting for you. Visit snowlegal.com. Call 704-358-0026 for a free virtual consultation. Located at 6827 Fairview Road, Suite D in South Park.
All right, everyone, listen, this is National Minority Health Month, and we are so honored to have a minority health physician here with us, African-American physician, which actually African-Americans only make up, that are female physicians anyway, less than 3%. That's unheard of. According to Fortune magazine, they said less than 3% is what I was seeing. Black women account for less than 3% of the United States doctors. That's a concern in itself. So I'm sure we're going to talk about that some. But let me give a formal introduction, and we'll go ahead and get started. Dr. Samira Brown is a board-certified primary care physician, pediatrician actually, who grew up in New England. Her parents, both college professors, raised her with one expectation. I'm not going to say what that expectation is. I'll give her the honors of sharing that. But her love for working with children led her to pediatrics, and throughout her career, she has been passionate advocate for patients and families. And her philosophy, we're going to learn more about that from her directly as well. That way I don't take your whole backstory, Dr. Brown, right? Anyway, Dr. Brown is a co-founder of Little Lives PPE and has been lending her voice to educate Americans, especially Black parents, on COVID-19 for the past 2 years. Welcome to the Kim Jacobs Show, Dr. Samira Brown.
Thank you so much for having me.
Thank you. Now let's talk about your backstory some, and tell us what made you so interested in becoming a physician, and also about your childhood growing up with parents that have, certain things that they've instilled in you.
Absolutely. I always knew I wanted to be a pediatrician. There was never anything else that I wanted to be besides a librarian because I love to read.
I can see you
Um,
as a librarian.
it was one or the other, or potentially both. My mom is an early childhood education expert, and she always worked in the school system and with children and families. And I used to tag along with her at work on a regular basis. My father was a jazz musician and had a PhD in ethnomusicology. So we learned about world music. He also taught African American studies. So, it really was not a question, in our household if you were going to college or not, right? So in terms of expectation, right, education was definitely at the forefront. And I think, also one of the most valuable things that our parents taught us was that we were always expected to give back to our community, that you could go out and do anything that you wanted. There was no expectation that you have to do this or you have to do that. You have to be a lawyer or a doctor. It was just that whatever you do, you need to give back to your community. So that was definitely something that they instilled in me and my brothers. So it was definitely a wonderful, family to grow up in, being loved. And they definitely, were extremely supportive of all of us in whatever we wanted to do. So that definitely has helped me have success in the things that I've chosen to do.
Wow. I know you've made your parents very proud, and you actually have a philosophy yourself that you really focus on when it comes to children. Talk to us about that.
So I think, for me, it's really important that every child deserves high quality, equitable care, right? It doesn't matter what color skin they have, what their parents do, what insurance they have, what chronic illness that they have, right? That every child deserves equitable, high quality care. And as much as we can work together with our families, with our patients, with organizations, right, within health institutions to make that happen, we obviously have a lot of work to do, especially in minority communities, because we have so many health disparities. So it certainly is something as a Black physician that, we prioritize.
That's good. Very good. And I know that there are so many health disparities. And one of the questions that came to mind is, that you may have seen in the African American community in particular, but I wanted to kind of talk more about COVID related disparities. Can you talk from that perspective as what you've seen personally?
Oh, absolutely. Right from the start, we saw very quickly, right, that within our community, there are higher rates of infection, higher rates of hospitalization, higher rates of loss of life. And as a pediatrician, we feel it every day, right? So one in approximately 300 Black children have lost a parent or a caregiver. That is a staggering number, right? They're 2.4 times more likely than white children to have had a loss, right? And so just the grief that comes along with the sequelae of this pandemic, certainly we are in a crisis of mental health in children across the entire United States, but specifically in our community, there's a lot of loss. So that on just a day-to-day basis is something that we talk about. So maybe it's their mom, their dad, their uncle, their aunt, their grandparent, their great-grandparent. And of course, we know about 1 in 5 homes here in the US is multi-generational.
That's right.
Right? So it's not that it's a distant, provider that they lost. It really is someone that they saw day to day. So it's something that, we have to make sure that we get supports in for the family, right? And specifically for children, that's developmentally appropriate to make sure that they're supported through this. But certainly that is one of the most, heart-wrenching, disparities that we're seeing currently.
That's interesting this morning, and I don't know how it just came across on my YouTube feed as a recommended video to watch. And it was from I think it was the Today Show, if I'm not mistaken. But there was a family of 4 African American children, and they had lost their single parent mother. And the story, it just broke my heart because I've been talking about COVID. I've heard about COVID. COVID has claimed over 1 million lives, and it's been a lot happening with every person that has transitioned from this earth. There's a name, a family associated with this disease that just hit the land and took the land by storm and took lives with it. And so when I was looking at that video, something I had never thought of until today, and I think it's probably God's way of saying, hey, know this information before you get a chance to talk to Dr. Brown, was that the 24-year-old daughter in this particular case fought to get custody and guardianship of her younger siblings. And had that not happened, those children would have been they've been together, raised by a single mom, loving them, caring for them. And they were really well to do, well communicating and all of this stuff. You could tell mom had done some great work with these kids. But the 24-year-old became the guardian of the younger ones. I wonder how many people didn't end up, and I don't know the number, and I know I'm not putting you on the spot to say the number, but there are so many that don't have that luxury, that they're split up.
I mean, we have a lot of families who then come in because now they're in foster care, right? But and sometimes it's a family member, right? And certainly that's going to be prioritized, right? You can only imagine a 24-year-old then taking on, right, being the parent, the caregiver, for their siblings, right? That is a huge undertaking, right? And the economic burden of that, right, on a 24-year-old, right? So like, how can they actually afford then? And they have to show that they can do it, right? And then you're right that there's some who then they get split up, right? And sometimes they're in a home with a foster family. Sometimes they're in, a foster care, center. So, and sometimes, of course, they're in multiple homes, right? So there's such an impact, that happens with children in trying to really build that resiliency. I think one thing about children is that they are incredibly resilient, regardless of what they experience, how many tragedies they go through, right? And what we find is that one adult, and it doesn't have to be an adult who's related to them, but someone who believes in that child and is consistent with them, that's what they need to be resilient. So that's another piece that we really try to educate our community on, that even if you're not related, right, step up and try to be there for that family.
That's beautiful advice. Any initiatives that you know about that have helped with some of the disparities, focusing with African Americans, that have helped in these situations?
So a lot of times there are organizations, and you should look within your own community, right, where they actually have specific groups, targeting kids who've lost parents. One of the national camp organizations is Camp Aaron. They do great work in terms of having free weekends where kids can come with other children who've experienced a similar loss as them, because sometimes it's just much easier to talk to somebody who's experienced the same thing. Right? Even teenagers who sometimes decide to become camp counselors, right? But there are great organizations, kind of in each, region that specifically target kids who have had these types of losses. And really, a lot of times kids, they need that encouragement to go. Right. And so it's also important. The stigma of seeking mental health too is something that we really work on. And so we want to make sure that folks know that help is out there. We want them to be able to not only get a referral, but to actually get the consult appointment. And a lot of times within COVID, we've been able to expand the availability of telehealth and telemed. So a lot of the grief counseling can actually be done via telehealth. So if there are issues with transportation, insurance, et cetera, that a lot of times we can now work through that much easier, really due to, things loosening with those regulations during COVID.
Well, so the Camp Aaron, and make sure I'm putting the right thing up. I don't want to share anything wrong. I'm going to share this and see if this is, I hope it's right here, but it's Camp Aaron Grief Camp, which is incredible resource. Is this correct?
Yes.
Okay. So I like sharing because that way you get a chance to get a visual of what you're going to be looking at. Everyone in the studio audience, we've put this link in the actual comment section for you, but Camp Aaron is all kind of videos, and some of the different examples of their activities are on YouTube as well. Camp Aaron, our house grief support center, and they give you the different dates that they have sessions coming up. And this is a place that is recommended by Dr. Brown. So make sure that you all check that out. Not during the show, everybody.
And they do. They have regional camps. So the one here in Georgia is called, I think, Camp Magic, right? But it's their, the same type of camp through Camp Aaron. So even though you'll see each region will, might have a different name to it, but if you go to that website, they'll tell you where the closest Camp Aaron is to you.
Oh, I love that. Okay. And so Camp Magic is in Atlanta. I get it. Oh
Yes.
my gosh. You know what? This is incredible. I'm going to show this one too. This is
Right.
in the area of Atlanta, Georgia, where Dr. Brown is. So this is why she's become familiar with this particular type, these camps that are nationwide. So this one is called Camp Magic. That's why I'm showing you, because it wouldn't be just spelled M-A-G-I-C. It's M-A-G-I-K. And that stands for Mainly About Grief in Kids. And they have different types of camps and activities. Who knows this stuff? I know I never even heard of this. So I am honored to have this as a resource that's available here for you all today. And thank you for sharing it, Dr. Brown. We really appreciate it.
Of course.
So even if you're not in Atlanta, or if it was in Philadelphia, wherever the other one was that I shared, make sure that you reach out to those particular entities and find out where one is that's close to you in a location near you. And if you know of any families, children that are left here on this earth that are grieving their parents, especially those that have passed due to COVID, recommend that they get a chance to have just some bonding time with other children that have experienced similar loss. Okay. All right. Listen, we're talking today with Dr. Samira Brown, and she is a board certified pediatrician, loves children, has always known that she wanted to be a pediatrician, or she would have possibly been a librarian, but I think she's probably a better pediatrician. You can always go to the library and volunteer if you ever decide to do that, Dr. Brown, if you ever have a moment in time in your schedule. But today she's focusing a full hour to just educate us about some COVID-related things, as well as stay healthy and stay well health initiatives. So when we come right back after this commercial break, we're going to talk about those stay well health initiatives and fairs right after this commercial break. So get prepared to talk about that, Doctor, right after this break.
It's not just another day. It's a brand new day, full of all the fun, love, and laughter you and your family create. Silver Shield Security understands feeling at home means feeling safe and happy. No credit checks, no contracts. We offer payment arrangements, and we'll even give you a free door camera. Find out how we can brighten your day even more at silvershield-security.com. Silver Shield Security.
All right, everyone, and we're back. We're talking with Dr. Samira L. Brown, and she is a board certified pediatrician, and super excited about having her here today. I would like us to talk more about the Stay Well Health Fairs and tell us what those are and how people can participate.
Yeah, so we would love for you guys to join us. So this is a partnership between the Cobb Institute and the We Can Do It campaign. And we are coming out to cities across the nation to increase your availability of education and also access to the vaccine in our Black communities. Our next one is going to be this Saturday from 9 to 1 here in Atlanta. If you're in our area, please come out, get some information. We're dispelling myths. We're doing health screenings. Of course, everything is free. And we are also vaccinating. So if you haven't gotten your first dose, or you're due for your second, or you're due for your first or second booster, please come out and see us. It's going to be at the C.T. Martin Natatorium and Recreation Center. And the following April 28th is one going to be in Inglewood, California. So we definitely go national. So there's a website, staywellcommunityhealthfairs.org. I know that's a mouthful.
Stay Well Community Health Fairs untitled.org, everybody. Make sure that you check that site out. That way you get a chance to know exactly which location is closest to you, the day and the time, and it's happening. So make sure that you don't miss these opportunities to be a part of how your community can stay well. If you need additional booster shots, this is going to be happening. Is it free for people to come?
Completely free.
Y'all, listen, don't miss free opportunities. And it's no strings attached or anything. The whole goal is to be able to help the community to stay well and to take away any excuses. Now I'm becoming a representative. I am a stay well agent here. No, it's like, what are you talking about? You're the host, right? But I do appreciate when we get a chance to have people like yourself and even other agencies pull together to take away any excuse for people to be well in this time. So yeah,
absolutely. Yeah. I mean, it's a great pop-up series, really targeted to our community because we want to make sure that you have trusted sources. So there'll always be physicians that are available to answer your questions. So please join us.
Now, let me ask you, this is specifically, I know you said targeted towards our community. When you say that, are you saying that this whole event is put together primarily for African American and minority communities?
Yes, specifically it's for, access to vaccines in minority communities, specifically the Black community. Of course, we're vaccinating anyone and everyone who comes, but specifically, we know that especially when the vaccine first came out, our community, our Black community was not getting vaccinated at the same rate. And even when you look at the rates currently, even though we've caught up, there used to be a 10% about gap in terms of the percentages of those who were vaccinated versus, those who were not, or versus white, right? We've caught that up in terms of the primary series, but now we're behind on the boosters, right? So more than half of Black Americans who are eligible for their booster have yet to get it, right? So the time is now. So you really want to make sure, look at your vaccine card, see if you're eligible. If you are and you haven't gotten it, come out to see us, or you can go to vaccine.gov and you can Vaccines.gov is a great way to just figure out where you can get a vaccine at any time. You can get it at your doctor's office, potentially CVS, Walgreens, right? All these other places that are giving it. There is never a charge for a COVID vaccine. Never, right? You don't have to go in for something else to, have access to it. So certainly we want to make sure that we're doing the work to make sure that our community is getting vaccinated on time, not only with their primary series, but also with their boosters.
But when we're talking about boosters, and you guys speak on your own behalf in the actual virtual studio audience, if you have questions, this is a time to ask somebody that's board certified and know exactly what they're talking about. Not just people that are coming on and just sharing our thoughts and our philosophies, but they know. For example, a question that I have is a booster really necessary? And I need to know that answer immediately. So
that's a great question. And the booster absolutely is needed, right? And so it depends on what your age group is, right? If you're 50 and older, there actually now are 2 boosters, right? The first one and then now a second one. And that is to make sure that your antibody levels stay up to a protective level. With anything, right? Your antibody levels can start to wane and go down. And so we want to make sure that with any vaccine that we're giving, that it is enough doses to keep your levels up so that it's actually protective. So if you think about it, we give flu annually, right? There's no vaccine that's just a single dose, right? So kids get series of vaccines to get them up to a certain level, and then they need boosters, right? So tetanus, you get your tetanus every 10 years.
Right.
So it's similar to that. And as we learn about different variants of, COVID, of course, sometimes we will need to change the interval, space it wider or closer together as we closely track that. So that's a great question. But to maintain your protection in terms of getting so sick that you need to go to the hospital, getting so sick that you lose your life, you definitely want to make sure that you're getting, boosted.
I thought the same thing. And that's the philosophy that I took it from. I said, Kim, you have to, when you're dealing with people telling you to start getting another vaccine. I know I have a permanent mark on my arm here that I think I was one of the last groups of people that had whatever vaccine that branded. It was like, this is a whole brand right there. Well, first of all, my whole shoulder blade is way too big to be just putting it up on the screen on highlight.
No, it's not.
I love myself. I love my
Beautiful shoulder.
blade and everything. But here's the thing. If it fills the whole screen, the point I'm making is there is a little dot that's on my shoulder here over on my arm, upper arm area, that is a permanent mark from a vaccination. I don't even remember what vaccination it was, but that kind of reminded me when the COVID vaccine came out that, Kim, you've been vaccinated for everything. You've been vaccinated for polio, for chicken pox, for mumps, measles, rubella, and all of these things, these immunizations that we do with our children. So my philosophy, and again, this is Kim Jacobs' personal philosophy, and I will put in the comment section that the views expressed are not always that of reflective of the show or myself. But in this case, this is Kim personally saying, why not go ahead and get the vaccination and protect myself and my family as best I can from the situation? And what you just said was so eloquently put. That was what I was thinking. I get a vaccine for everything else. I might as well go ahead and try to protect myself and my family from this too. But I do believe ultimately, God is in control of all things, and he knows what he's going to allow and what he doesn't allow. That's between God and the universe and all that stuff. I'm not God, right? But if there's a way for us to be educated and to walk into the knowledge of the truth, we get the truth, we walk therein. And this is some truthful information. We should get the boosters. That's what you're saying, right?
Absolutely. You definitely want to make sure that you're getting a booster. And certainly if you have children or folks who have children, those who are 5 and up are eligible to get a vaccine. That's another place that we actually are seeing a disparity, right? So if you look in the Black community, less of our children are vaccinated, leaving them more vulnerable. And at the same time, just like adults, children are more vulnerable to sequelae, right? They're more likely to be hospitalized, more likely to lose their lives, and also now more likely to suffer the long effects of COVID. So long COVID, or what we call MIS-C or MIS-C. It's the multi-inflammatory syndrome in children.
Let's
right?
Say that one more time.
MIS-C.
What is that again?
That's multi-inflammatory syndrome in children. And you may have remembered hearing about this at the beginning of the pandemic, that there was this Kawasaki-like disease that kids were all of a sudden getting. It presents a few weeks after infection, and it's not always a known infection. So some of these children never had a documented infection, but then when we test their antibodies, we can see that they actually did have a recent infection, and it ravages their body. Now, these kids get extremely sick. 1 in 100 of these children lose their lives. Most of them are cared for in the ICU. It is mostly in Black and brown children, a little more common in males. The median age is around 9, but especially that 5 to 11 year range. So certainly if you have children who are having more than 5 days of fever, a lot of times there's abdominal pain, vomiting, chest pain, shortness of breath, any of that. You want to make sure that they're thinking about MIS-C, even if they don't have a known history of having COVID, because the sooner you come in for a treatment, the better your children are going to do if they end up getting MIS-C. And remember, again, this is rare, but if they do have it, it is something that certainly can be treated, but is a very serious illness.
That's unbelievable. And we need to know this information. So it's right here on cdc.gov, and it's MIS-C associated with COVID-19. And they say, here are some of the things that: stomach pain, bloodshot eyes, diarrhea, dizziness or lightheadedness, skin rash, vomiting. This is important information. And it even tells you on this site when to seek emergency care, but it's not something that we should take lightly. And again, I'm hearing this here. I've heard it before, but never, I don't know if it's just your voice that's soothing or what's so reassuring. I don't know what it is about you, Dr. Brown, but thank God that he's sending you into the African-American community to just educate us, because I think I personally am hearing it slightly differently from you. I don't know why.
I think for me, I definitely want to make sure that families don't come back and say, well, I didn't know that this could happen, right? And really giving you the information to make a good decision for your family. And my job is to respect the decision that you make. Right. I'm here to give information that we have, what we know, what we don't know. Right. And then respect the decision that you make. And it's part of building that trust, with families. And also, too, I want my families to be armed with the information. So when they do go in for care, they can say, have we ruled out Miss C? Right. Because sometimes you're not getting the same care as someone who doesn't look like you, unfortunately, right? Sometimes there's implicit bias. So when we look at African Americans who present to the emergency department, were they getting hospitalized at the same rates at the beginning? They were not, right? Were they getting up-to-date therapies? They were not, right? So if we don't know to ask, it can make a really big difference if we're only relying on the provider who's treating us, right? So I also want to make sure that families have the information that they need to advocate for their children and also for themselves.
I love this. And thank you for taking the time to educate us on what to even have in our toolbox when we go into having these conversations. You actually got a chance to witness a conversation for a few seconds that I was having with one of our medical physicians because my daughter was having some challenges and 3 of my children have cystic fibrosis. But when the doctor office returned the phone call, you can't miss the call, right? It's like, don't miss the call. And Dr. Brown and I were
That's
back.
everything.
Right. It's like you can let that go to voicemail all you want, but you need to be the advocate for your children, especially if they're dealing with any type of disorder. It doesn't matter if it's only COVID or if it's something else. In my case, it's cystic fibrosis. But the children need parents to be their advocates, don't they?
They absolutely do. You always know your child better than any physician will, right? So when you have that intuition that something is wrong, even if it's me, right? I tell this to my patients. If you have that gut feeling, push, because when we go back and we look at things that got missed, most of the time the parents knew something was wrong. So don't feel bad about challenging. Don't feel bad about asking questions. We expect you to have questions and we should be able to talk about it, right? And don't feel bad about seeking second or third or fourth opinions, right? So your health and the health of your child always has to be the priority.
That's good. I take note on that as well. When we come back, I'd like to be able to talk about your story as an African American physician, some of the things that you've experienced, good, bad, indifferent. Talk to us right when we come back, because I'm sure you've experienced quite a few things in your profession. You have that beautiful smile and everything over there, but I would love to hear, have you always just had that glow about you, or have you been in some
Everybody has their days, right?
So talk to us about some of your days when we come back after this commercial break. And everybody, make sure you're sharing this broadcast, encouraging people to tune in. And even if you're starting watch parties later, make sure you do that. Obviously, we just signed a contract. We're going to be airing this same broadcast on Believing Your Dreams Network, which will air on Roku and all kinds of different streaming devices, Amazon, so forth. So we're excited to be able to get this program out globally, and you're all going to be able to hear this information as we continue with the Kim Jacobs Show. Right after this commercial break, we'll be right back.
When someone has lost a loved one, they want to know what exactly happened. They want to know, is the other person going to be held responsible? And they want closure. At Hunter & Everett, we help clients that have lost a loved one move on, and to do that with dignity and respect that they deserve.
All right, everyone, we're back and we're talking with Dr. Samira L. Brown, board certified pediatrician, who's here to talk to us today. She's been talking about Stay Well campaigns that's happening and different initiatives that are taking place to help us regarding COVID-19, some boosters and all types of things that are available to us, especially as an African American community. And at this point, we're going to get to hear some of the things she's experienced as an African American physician. So talk to us, Dr. Brown.
I mean,
well, but wait, before you say this, let me cut you off for 1 second, only because backstage, I did ask her what her nationality was. I was like, what's your nationality? She was like, Right, I'm African American. But I'm glad I asked because I think that if you're not sure, you should ask, right?
Absolutely. And I
Okay,
did. I
carry on.
shared that story. I was a patient myself. And there was, a nurse typing in some information about me, and I could see over her shoulder on the screen, and she had typed in that I was a Hispanic, female. And I had to stop her and tell her that she should actually ask her patients rather than assume, right, what their ethnicity or their race is, right, if that's something that we're going to include. And also, too, knowing that sometimes that's relevant, sometimes it's not, right? But making sure that you've been identified correctly is definitely something that's important.
Right. So now, with you being African American, tell us a few instances that you maybe have run into in your journey that threw you off kilter a little bit.
I think one of the most impactful scenes for me was when I was a resident. I was an intern. I was in my first year. It certainly was not the first few months. So you feel like, you've got things kind of under your belt. And there was a kid who was getting very sick, and we needed to draw some blood right away. I had taken off my white coat and I had scrubs on. I had gloves on and was drawing blood. And one of the specialty teams came to the door. And this is a team that I would round with every single morning for probably approximately like 3 or 4 weeks. So it wasn't like we weren't familiar with the team. And the fellow came over to console me as the mother of the patient because the patient was Black.
And now this is someone that you had already been working with for a while, and you're like, wait, what?
And I have gloves on. I have a syringe in my hand. I am literally about to stick a patient, and she's coming over. The parents were not in the room at the time, but she came over to console me, to let me know that this patient was going to be just fine because she thought that I was the mother.
Well, did you have something covering your face and it was only your eyes showing?
This is pre-pandemic. There was nothing. I mean, it was, me and my scrubs. We talk about this, the danger of taking your white coat off, right? Are they going to be able to see you as the doctor, right? Even with your white coat on, right? A lot of times you're just not seen as the doctor from both folks who look like you and both who don't, right? Sometimes they're not quite sure who you are, even when you introduce yourself, even when you have that white coat on. And so, when I told her that I certainly was not the mom, right? That I was Dr.
I'm sorry,
Brown.
please.
And the
Dr.
intern on the team.
Brown, I have to role play. I'm a role play person, okay? So I have to role play this, okay? Okay, let me take my glasses off. I don't even need my glasses except for reading, but I'm trying to make sure I don't miss your comment. But right now, we're going to take a moment and just role play. Work with me, okay, Dr. Brown? Okay. So I'm actually on your team. I'm sorry, I'm on your team. And we've been working together for a while, right? And so we're all going in. There's an emergency situation. You're prepared, you're prepped, and you have your gloves, your sterilization on. Here I come in as your team member that I've talked to you for the last month. Hey, Samira, how are you? Nice to see you, Samira. The whole time. Now I come in and I'm like, don't worry. Everything's going to be okay. Everything is going to be okay. We have this. As a team, we're committed to making sure that we help your child become better. So you don't have to have any worries or any fret. Don't be taken aback by this situation because we have you and all of us are working together. Now I'm talking to you. My team. Okay.
And I mean, when I tell you, you've got it 100%. She was so sweet, so nice in her approach of me. And I kind of looked down again and looked around to just make sure, did the mom come in and I didn't see her come in?
No. We understand you're flustered, you're frustrated, you're nervous. It's okay. We are here to help you. So what can we do to make your situation smoother right now as we get ready to take care of your child?
I'm not the mom. I'm Dr. Brown. You see me every morning. And her reply to me was that, well, you could have been the mom.
Okay, stop. She still took zero accountability for making a complete error in this situation. No, oh my goodness. Dr. Brown, I am so sorry. I cannot, oh, I am so embarrassed right now.
There was no apology in the moment. And I kindly asked her to leave the room because we didn't actually need her specialty for what was going on. So I knew that I could do that. But in a sense, right, it's also, taking that ownership back of the moment, because the focus now can't be on my feelings.
On you.
It has to be on this child who's acutely ill. But I know that your presence can affect me, right?
It has to be
had this interaction.
That I'm the physician getting ready to perform the procedure with these gloves, with the scalpel, everything, and you can see that I have these things. So you need just some extra training, right, or something.
Yeah. And I was very lucky that both her attending and my supervising resident were both in support of me and made her leave the room, right? And they were both very apologetic. And of course, the subsequent next morning,
yeah, I was going to say,
he apologized to me on rounds, I think, after getting some education, probably from her attending, right? And we talked about it as a group, right? And two, I was in, the Northeast, right? We already know you talked about that statistic, right? There are very few of us, who are going to be there. Luckily, I had, probably about 4 or 5 other Black women just in my class, which was unheard
that's
of.
amazing, right?
It was absolutely unheard of, phenomenal physicians. And so I had other folks to support me, through that experience. And I think almost any doctor that you talk to has been addressed as someone other than the doctor, or been asked to take an order in a room, those kinds of things that we experience. But I think you have to, one, I call it wearing your raincoat, letting those things, trickle down, because all of those little things that happen, if you're letting them build up in you,
your sponge is going to overwhelm you.
And it's going to affect my long-term health, right? I don't want my telomeres shortening because something somebody else said to me, right? So learning to try to feel it, address it, acknowledge it, help that person if you can, right? Talk about their implicit biases so they can be better, right? But then also making sure that you're reprioritizing yourself, your patient, and moving on from it, right? So that certainly is something very early on that I experienced.
I have to know how you progress through that. So at the end of the day, I know the next day she got her training, whatever. Please tell us, what was the outcome? Was it like, wow, please, I'm grateful that we had that encounter because it's educated me. It's helped me become a better person. I'll never make that mistake again. Please accept my apologies. Tell me how did this end?
It definitely was a heartfelt apology that she gave the next day, and we didn't discuss it again. But I also can't tell you, we had very little interaction, kind of after that. We only had a few more days left on service with each other. But it was definitely very memorable, I think, for my class, certainly with the residents that experienced it with me for years. They would still come back and talk about it, that they were really flabbergasted. So it also helped them understand what my perspective is, right? And two, of that patient, right? Of who's caring for them and the assumptions that are made when you come into a room based on just what somebody looks like, right? And that we all have work to do in terms of implicit bias, but that was definitely one for the books.
That's one for the books. And we never said a name. So don't reach out saying somebody's defaming anything. I'm going to tell you in advance, we don't know who you are. So if we saw you walking down the street, we wouldn't know. We just wouldn't know. Okay. But whoever you are, wow.
Hopefully they're being their better selves.
Anyway, we'll move past that. Listen, I know that this is National Minority Health Month. And before we close out today at all, I want to make sure we talk about it from that perspective too. Any tips, advice, things that you want people in the community to know pertaining to Minority Health Month from your perspective as Dr. Brown? And I know the We Can Do It campaign, all of these things, please make sure we talk about that some. But let's take a commercial break first. Because I think after talking about that situation right there, you know how you be like, okay, that was a little bit intense. Let me just take a moment to act my brow. That was a lot. And
It was
I do want to know, did everything work out well with the child? Did the mom and
Yeah, so the child did extremely well. The parents, were notified. They came back. This was a kid who had been in the hospital for quite a long time, and had, wonderful parents who were there most of the time. It just happened to be a moment when they weren't,
right.
and so the child did very well. Thankfully, and of course, relationships were repaired. So
That's such a blessing. I wanted to hear the ending to this lifetime. Technically, it's like a lifetime story. Here, like what? What was that? It's like,
yes, the child is completely fine. Thank goodness. But
thank goodness.
too,
I know
just good lesson.
that's a good lesson learned. And it's a good lesson for all of us to learn. So as we hear that story, make sure that we know that if you see Dr. Brown and she's African American and you have your child in the hospital, don't assume that she's one of the nurses or is one of the people that's on the floor helping in that regard. Just, you don't know. I always, believe it or not, when I approach someone, even just in a store, I always ask, are you the manager? Because I don't know who the manager is just because it's a younger Caucasian female in this particular instance that I'm talking about does not mean that she's not the manager. So I always say, are you the manager?
100%. And two, if you're in the hospital, the number of folks who come into your room in a day, I think on average is 60.
Yes.
You want everyone to introduce themselves and tell you who they are and how they relate to your care team, right? So we also teach that to our peers, to our residents, to our medical students, that when you come into the room, you need to identify yourself and tell them who you are and how you relate, right? So it may be Dr. Brown, but I may be the resident on the team, right? I may be a fellow on a specialty team. I may be the actual attending in charge of your care, right? So it's important for you too, as a patient, to don't feel hesitant to ask folks, hello, good morning, and who are you on the team?
That's right. And I can tell you another personal story right quick, that with my daughter in particular, she's had many hospital stays, that 10, 15 days at a time, with PICC lines and bronchoscopies and leveling out her levels with cystic fibrosis. And at home, I train her that you do not talk to strangers. You do not deal with strangers. You don't know these people. So why are you like, hi, everybody, like this to these strangers? And especially with her being a female, and I have 4 sons, so having a daughter was altogether different ballgame for me. I have a friend that had girls, all girls, and she used to teach them blocking methods, to hug sideways, all kind of stuff. I was like, what kind of drama is this that you're telling them? You see what level you're at their body, so you turn sideways. I was like, please stop doing that. But now when I got a daughter, I realized everything that I have witnessed her train her children on. I was like, oh. So whenever a male nurse, I'm getting somewhere here, Dr. Brown, when a male nurse would come into the room, then my daughter is like, you're not going to leave me in this room for any reason to run and get a snack downstairs. Because sometimes if a nurse would come in, I would run down to go grab something, because then I knew somebody would be in the room with her for a few minutes. She was like, not when this male nurse is in here, because at the end of the day, is he a man or is he not a man? And the answer is yes. So it contradicts the training that we teach at home sometimes when they experience it in a hospital setting. Any thoughts?
Absolutely. It's so important to talk about prevention in terms of abuse. Right. And I think it's good for parents to know that right at the age of 4 is when kids start to understand the concept of a secret. So you want to teach your children, no one should ask them to keep a secret. And remember that it can be same sex, opposite sex, right? And you want to know who they're playing with, what kind of games they're playing. And you want to talk about that every day. It should just be a daily conversation. Anything else you want to tell me? Anything else? They should know they can say no to adults, of course, politely, right? And that they're not going to get in trouble. And most of those things happen with someone who's not a stranger. It's usually with somebody who's gotten to know the child, right? So it's really important that you practice it, right? Because sometimes you initially teach it, but you've got to come back to it and talk about, can Dr. Brown check your underwear, right? Only when, right, mom or dad is here and they're right, I'm going to have them stand up and look and see everything that I'm doing, right? And always telling them too that it's okay to say no to that, right? And can your neighbor check? Can your cousin check? Can your teacher check? Can your friend check? Right? So just practicing with them and making sure that they're confident in saying no.
That's really good. And right now, with my daughter being a teenager, she's only had a male physician, which is our family male physician, and we love him, we adore him, and he is the best male pediatric physician that exists in the world, in my opinion. And he knows how to
I love it.
communicate. He knows how to communicate with our children, and I'll say his name, Dr. Freeman, and he's in the Charlotte, the pediatric area of Charlotte, North Carolina. Prosperity Church. Anyway, he's a great male physician. But now with my daughter being a teenage female, she wants every once in a while to just have a female when she's on her cycle, different things like that. And he's like, oh yeah, that's fine. Do whatever works for your family. And he's perfectly fine with it. But we've never formally changed her physician to someone else. But sometimes she will request a female that's on his team. And that's a great doctor that understands that dynamic as well.
Mm-hmm. Absolutely. And it does. It happens to all of us. And you want your child to know that whatever makes them comfortable, right, is what's going to be the priority.
Good. This is good discussion. Listen, if you all have your own questions and comments, make sure that you're popping them in the comments section, and also share this broadcast. I encourage you all, I will take a moment to say that through your online contributions here to the Kim Jacobs Show, this program comes on Monday through Friday, 11 o'clock a.m. Eastern Standard Time. The only way that we can have a program that comes on at this level with fantastic guests like Dr. Brown and all of the guests that you've been seeing here on the platform is if we have online contributions from people like yourself. I do think just yesterday we had an online contribution from Miss Reese Wheatley, and thank you so much for being one of our online contributors. I'll always give some shout outs when people contribute to the program. So make sure you do that in one of the ways that work best for you. And also take a moment to subscribe on our YouTube channel. We greatly appreciate your support. Right after this commercial break, what direction do we want to go in? We still could talk about, if we want to talk about new phases of the pandemic, if you want to talk about, I wanted to find out right quick, that we can do this. We've already talked about that with the stay well. That is, we can do this, right?
Absolutely. Yes.
Perfect. Okay. So I'm excited about that, and we'll remind people at the end of the broadcast. But I want to see if we could talk about any new phases of the pandemic that you know about and want to share with us immediately after this commercial break.
Absolutely.
You enjoying yourself?
I am.
All right. And at the end of the show, I need you to stay backstage for 1 minute because I need you to do one thing for me, and I'll tell you afterwards. Okay. We'll be right back, everybody.
Nothing says I love you more than final expense insurance whole life protection. With funeral advocacy nationwide, saving you and your family 30 to 80% off funerals and cremations. Nothing says I love you more than Get Insured Solutions, LLC. GetInsured.Solutions, 704-499-3616.
All right, everyone, and we're back. We're talking with Dr. Samira Brown. She is a Please forgive me. She is a board certified pediatrician, and we're honored to have her here today on the Kim Jacobs Show. One of the things I noticed is that we're entering into a new phase of the pandemic, and people that haven't really received their booster shots, you've already touched on it some, but I just wanted to see if you could elaborate a little bit more.
No, of course. I think now we're in a new phase where they're really relying on you to check your community transition rate, right? Which definitely means that you need to actively go to either your Department of Public Health or the CDC site and look up what the transmission rate is in your community so that you're staying abreast and staying ahead of those cases coming back up. Because if you look, we had a down surge and now we're starting to upswing. You also want to keep in mind that a lot of places have started to unmask, right? And this is an incredibly contagious virus. So if you're somewhere back indoors with lots of people, your increased risk, right, is going to be very different than it was a year ago, right? And then what you use then to protect yourself, right? The initial recommendations were definitely supply based, right? But we as physicians aren't recommended to use a cloth mask to see flu patients, and certainly not COVID patients. So you want to make sure that you're protecting yourself with a medical grade mask when it's appropriate, when those rates start to go back up. And also think about your community's vaccination rates as well, because that also affects how many people are actively transmitting, right? So if you have a lower vaccination rate where you live, your risk is going to be higher of getting exposed. So you do want to be very, very careful as we learn to live with COVID, right? That you're not taking, undue risk. And when in question, please, please, please call your doctor. Right. And if you need to, call your pediatricians, because we certainly will give advice if we need to. If you don't have a trusted physician, please get one for yourselves. But certainly if there's one person you can ask, it's definitely your pediatrician as well.
Absolutely. And now, can people get COVID more than one time? I would like to know the answer. Is that possible once you've contracted COVID? You can get it again?
That's a great question. You absolutely can get it again. And so it's rare for you to get it within the first 45 to 90 days after you've had it. But then after that, absolutely you can get it again and should be getting tested. And certainly, now you can have free tests from the government at home, available at home. There should be, tests that are readily available in terms of around your community. So if you're starting to have symptoms, even mild, go get tested. But always keep in the forefront of your mind that most COVID infections have no symptoms at all. And you can also have it for 2 weeks before you yourself become symptomatic. So you always want to make sure that you're keeping that in mind. That piece has not changed. It's just significantly more contagious than it used to be.
Right. And I like the fact that when I was reading some information that the COVID vaccines are tailored to children that are in that age category of 5 to 11. It's not like they're putting the adult vaccination right into the child. Is that right?
Absolutely. So the Pfizer vaccine is the only one currently that's approved for children 5 to 11. It's a third of the dose. Their immune systems work better than ours do, right? So they don't need as high of a dose to get the same level of protection. They're experiencing no severe side effects from this. There have been over 8 million children 5 to 11 who've been safely vaccinated just here in the United States alone. And those rates vary widely between different states. So you want to definitely take a look. But if your child has not been vaccinated yet and they're 5 and up, today is the day. So COVID is not going anywhere. We're just learning to live with it. And it's much safer to be vaccinated than unvaccinated.
That's good. Much safer to be vaccinated than to be unvaccinated. That is a quote from Dr. Samira Brown here on the Kim Jacobs Show. Tell us, as we prepare to get ready to close out, something about you personally. What do you do for fun? Do you hang out with your family, go to the movies, walk?
All of that. All of that. I definitely do, meditation. I work out. I love to go to the botanical gardens here in Atlanta and the High Museum with my mask on, of course. So I definitely love to spend family time. I have 2 nephews and now 2 nieces. I have a brand new niece who's, just 2 months old. So it's a lot of baby time right now.
Oh, awesome. Listen, we cannot have had a better experience. I hope that you had a wonderful time here today as well. And I'm so honored that you were our guest. Tell us one more time about this event for anybody that just tuned in.
So yes, please come out to the Stay Well event. If you're here in Georgia, in the Atlanta area, it's going to be this Saturday from 9 to 1. Please come out and see us. There's another one on April 28th in Inglewood, California. And you can get all the information at staywellcommunityhealthfairs.org. So please come and see us.
All right, everyone, tune in tomorrow. We have guests that's going to be talking about when you are at your breaking point. You don't want to miss that episode We'll see you tomorrow. Stay backstage, Dr. Brown. We'll see you all tomorrow at 11 o'clock a.m. Eastern Standard Time. Have a great one. Hello, everyone. I'm Kim Jacobs, host of The Kim Jacobs Show, where we're bringing balance to the world, one household at a time. Listen, we go live every weekday, Monday through Friday at 11 o'clock a.m. Eastern Standard Time. I bring guests on that talk about their backstories, things that they've had to overcome to become who they are today. Many of them are balancing and juggling life, and they've become experts in different fields. So they're sharing tips with you to make your life just a little bit easier. Many times as a guest in the studio audience, you'll get a chance to walk away with a missing piece of the puzzle that might be missing in your life. Let's go on this journey together, and I look forward to seeing you Monday through Friday at 11 o'clock a.m. Eastern Standard Time, right here on The Kim Jacobs Show.